Hey everyone, this is Susan with NRSNG. Today we will be working through a care plan on anemia. To see our massive free database of nursing care plans, just visit nrsng.com/nursing care plans. You can also download our free editable PDF care plan template that I am using at nrsng.com/care plan template. So let's get into me filling out this anemia care plan. I did 3 nursing diagnoses for anemia. My first one was fatigue related to low red blood cell count. So your patients are going to be exhausted. They're not going to be receiving the nutrients they want. Their body wants. They're not going to be able to do the things that they once were. So they're going to be super tired and fatigued. The second diagnosis I wrote down is activity intolerance related to low red blood cell count, and this can be evidenced by dizziness, orthostatic hypotension, shortness of breath, things like that. They're not going to be able to do the things that they used to do prior. The last nursing diagnosis that I came up with is impaired gas exchange related to decreased cells to carry the gases, as evidenced by shortness of breath will be one of them, especially shortness of breath upon exertion. But the body doesn't have the number of red blood cells to carry the oxygen to the places that it needs to go and to exchange it within the lungs. So there's going to be a lower O2 count and possibly a higher CO2 count as well, depending on how well the patient is compensating. So for patient goals, I wrote the first goal is to increase iron, folic acid, and vitamin B12 intake. And these things can actually vary depending on what type of anemia that you have. But even if you have any of the types of anemia, you can increase all 3 of these and they would be helpful to your anemia. So you'll want to, for the rationale, you'll want to educate the patient on foods that are high in iron, folic acid, and vitamin B12. These are like meat, fish, eggs, spinach, those kinds of foods that you just want to let them know, hey, you need to increase this amount. Another thing is that if they are unable to increase this amount, you might want to start working on supplements for them. So yes, we're going to implement this. And then to evaluate it, we're going to check the patient's blood levels when they come back to check in and adjust their diet as needed with supplements. So if they're saying, I've been eating all of the spinach, all of the red meat, those kinds of things, and it's not improving, they may need to be on supplements. And you'll want to definitely talk to them about side effects of like iron supplements can, sometimes constipate you or make your stool really dark, things like that. So side effects of supplements definitely need to be discussed with the patient. For the second patient goal, I put take precautions to avoid passing out and falling. So the patient needs to be aware that they are at an increased risk for syncope and an increased risk for falling. And this is strictly because of orthostatic hypotension, which happens a lot with low blood volume. So if you have low red blood cells, you also will likely have lower tolerance for changing positions quickly. So make sure that you teach them to, when they sit up, sit for a few minutes before they stand up. Don't just get from lying to standing quickly. And then to help them if they understand what feeling like passing out might be like for them. So some people get really hot and sweaty. People get really far away. They get dizzy. You just want to tell them, sit down. Make sure you're sitting down. So for our intervention on that one, you will want to check the patient's orthostatic hypotension results, first of all, to find out if they are having any orthostatic hypotension. Even if they aren't, still educate them on it, but you do want to check to make sure that that patient doesn't have that. And then educate them on changing positions slowly, sitting down if they feel dizzy, things like that. Yes, we are going to implement this, and to evaluate, we are going to have the patient demonstrate changing of positions. So this is like the verbal read back. You are going to have them actually show you that they understand what you're talking about. So also give them verbal affirmation on signs or symptoms to watch out for when they're, potentially going to have syncopal episode or potentially going to fall. So for the third and final goal that I wrote about, keep a diary of signs and symptoms as well as a sleep log. So patients who are anemic can tend to sleep a lot because they're extremely tired. Having a sleep log is super important, because if they are oversleeping, it's really causing issues in their activities of daily living. And I actually tell almost all of my patients to keep a diary of anything that's going on, so that if they do need to come in, they can say, hey, on this date this happened, and on this date that happened, and I had dark tarry stools. Because when you get to the doctor, I have seen this happen before, all of a sudden you just don't remember a gosh darn thing you came there for, or you're like, I know something happened, but it's you just get really nervous. So I definitely make sure that my patients keep a diary, and I think for anemia is a good one, especially because it's so it's not cut and dry. You need to educate the patient on signs and symptoms to record. Examples of these are lethargy, shortness of breath, dizziness, blue fingertips for sure, and also if they have blue fingertips, they should probably go to the ER. And then the regular hours of sleep. Yes, we are going to implement this. And when we evaluate the patient, we will go over their diary, go over the events with them, give them feedback at the next checkup. It'll be a way for you to go through and say, okay, these are the events that happened. It's almost like reading their chart. When the patient comes in, you read their chart anyway. It's like a chart that they're handing you. This is what happened, and you don't even have to chart it. So I find it super helpful, but go over it with them, have them re-talk about the situations that happened, and if there's anything that's concerning, make sure you address it. All right, so that was the care plan on anemia. Thanks a lot, guys.
Visit nrsng.com/nursing care plans for our huge free care plan database, and nrsng.com/care plan template for our editable care plan template PDF. This has been another episode of the NRSNG podcast. Thank you for joining us, and thanks for being a part of the NRSNG family. Now, go out and be your best self today.